Good afternoon, everybody. Welcome to our Heart Health Lecture Series at the Center for Prevention of Cardiovascular Disease. We have a wonderful topic and a wonderful speaker today, all about exercise for all ages, and I'll be introducing our speaker shortly. Next slide. As you all know, I'm Dr. Dennis Goodman, a clinical professor in the Department of Medicine and Director of Integrated Medicine at the Center for Prevention of Cardiovascular Disease in the NYU Grossman School of Medicine. Next slide. I want to thank Anya so much for all her help with this series. It's really become something that's very popular, and we are very proud that we have now a library with many of the previous talks. You can scan this QR code, or you can go to nyulangone.org/hearthealthlectures, and you'll be able to find most of our previous lectures on YouTube. We actually have close to 100,000 hits now. So if you miss a lecture, or you'd like to tell your friends about it, or you'd like to go back and revise it, it's easily available. Next slide. So this is just to remind you that I take questions during the talk, live questions. You just go to the Q&A button down there and put in your questions. We've already received questions that have been sent in, and I'll get to as many questions as possible. Next slide. So we're very honored and privileged to have a real expert. He's not just an NYU Langone expert. He's really a national, international expert on exercise and obesity and its relationships. And this is Dr. Sean F. Heffron, who is an assistant professor and director of cardiovascular fitness and nutrition at the Center for Prevention of Cardiovascular Disease. He's one of my colleagues. He's a very popular physician amongst his colleagues and the patients. We love having him in the department, and I'm really grateful that he agreed to speak at our series today. Dr. Sean Heffron is a preventative cardiologist and Director of Cardiovascular Fitness and Nutrition, as I said. He has specialized training in exercise physiology and nutrition, and is passionate about equipping patients to engage in lifestyle changes for disease prevention. In addition to his clinical interests in lifestyle modification, Dr. Heffron has an active research program that focuses on the impact of obesity and cardiovascular health. He's been at NYU since 2011, where he did his cardiology fellowship, and then a postdoc, and then stayed on our faculty. He was at the Mass Gen for his residency, so he's highly qualified. He's a real incredible member of our team, and we're privileged to have you speak to us today. Thank you very much, Dr. Heffron. Over to you.
Thank you, Dr. Goodman, for the invitation and this opportunity. Let me go ahead and share my slides here. Okay, looks like they're up. So today I want to touch on, kind of broadly speaking, three major topics, all related to exercise, giving you kind of a little bit of the background evidence as to why we talk about the importance of exercise and physical activity so much in the realm of cardiology, and then go on to give some practical advice in regard to types of exercise, amounts of exercise, what an exercise prescription is, and then hopefully some ideas that you can take home, some easy rules of thumb to improve your cardiovascular health by incorporating more physical activity and exercise. So the importance of exercise is not a new observation. This is a quotation from Hippocrates thousands of years ago, in which you can see he said, "All parts of the body which have a function, if used in moderation and exercised in labors in which each is accustomed, become thereby healthy, well-developed, and age more slowly. But if unused and left idle, they become liable to disease, defective in growth, and age quickly." And certainly that was an accurate observation, but it was more or less an anecdotal observation based on his acute observation of a number of patients. But certainly in modern medicine, we like evidence, and the evidence supporting the importance of exercise and physical activity in cardiovascular health specifically originates now almost about 100 years ago. And some of the most important studies, foundational studies of the importance of physical activity came out of the UK. And one of my favorites came out of the London Transport System, published now almost 80 years ago, in which the researchers looked at relatively homogeneous groups of individuals. So they looked at employees of the London Transport System, and of course, as the slide before showed, the double-decker buses in London. And they looked at people with two jobs, and the people with these jobs were overall pretty homogeneous, meaning they were basically middle-aged white men, so in that sense, very similar. And in the same environment, meaning they spent all day on the buses, but the chief difference between them was the amount of physical activity that they performed in their daily routine. Of course, there was a driver who sat sedentary throughout the day, and then the ticket taker who walked up and down the aisles, and importantly on double-decker buses, up and down the stairs. And as you might suspect, given kind of the what we know about exercise today, those individuals who were the ticket takers experienced lower levels of cardiovascular disease and cardiovascular mortality. And this was an observation that similar research across England and Wales, again, now 80 to 90 years ago, found across social classes that, as this figure demonstrates, those individuals who performed heavy amounts of physical activity, and this was just in their daily lives. This was, 80 years ago, there were not the preponderance of gyms that we have today. So these people weren't doing exercise kind of in their free time. That's a relatively new concept. These were just people doing a lot of activity in their daily life and as part of their employment largely. And you can see that those individuals who were not sedentary had the lowest rates of cardiovascular disease and death. And the same holds true today in that, we have far less physical activity that occurs as part of our daily lives and certainly in our working lives. And unfortunately, insufficient and in many cases absent physical activity is felt to be responsible for more than 10% of American mortality annually. And so I spend a lot of time counseling patients on a healthy lifestyle. And when we say cardiovascular lifestyle behaviors, we're often talking about diet, smoking, sleep, stress levels, but of course, physical activity. And there is some evidence that being active may actually be the most important of all of those lifestyle factors that we spend so much time talking about. And evidence for the importance of this comes out of a study that not new by any means, but the lack of newness actually allows it to really drill down specifically on this lifestyle factor. So this was a Mr. Fit study begun over 40 years ago, which randomized 13,000 middle-aged men without heart disease, but who are at high risk for heart disease because of smoking or being overweight or having high blood pressure, etc. And they were randomized to being educated on cholesterol with dietary changes or quitting smoking or no education. And then they had their blood pressure treated with additional medications. So education and additional blood pressure treatment or nothing. And exercise was not at all a part of this program. And interestingly, somewhat disappointingly, I'll be honest, there was no difference in mortality or heart attacks between the group that got diet and smoking education as well as blood pressure treatment and those who got nothing. So maybe it makes you question the how well they were doing in their counseling. Nonetheless, afterwards, when they found no difference between the two arms, the researchers combined these two groups, the diet education group and the no intervention group, and then they looked at their amounts of leisure time physical activity, and then did a comparison of mortality. And you can see here that, wow, there's certainly a separation of these curves, with this curve having almost twice the amount of cardiovascular heart disease mortality than these. And maybe you won't be surprised to see that this top curve represents those individuals within the Mr. Fit study who are sedentary, and the lower curves being those who are active, suggesting that the importance of physical activity may even override the detriment of smoking and inadequate controlled blood pressure and cholesterol by diet. Additional data supports the impact of physical activity on being protective of heart disease and overcoming some of the negative impact of obesity. So these figures represent here that an individual who is obese, but who achieves American Heart Association physical activity guidelines, which I'll speak about in the coming slides, actually has a lower level of mortality than someone who's normal weight, but who is sedentary. So showing that it's better to be fat and fit than lean and sedentary. And why might that be the case? Well, because being active overall reduces someone's risk of heart attack by about 40%. And it does this regardless of gender, race, and one of our foci today, an individual's age. How does it do that? Exercise is anti-inflammatory. It reduces inflammation, which is very important to the pathophysiology and the progression of heart disease. It improves blood vessel function, how well the blood vessels act as a barrier to keep out cholesterol, how well they dilate to allow adequate blood flow through them. It increases levels of HDL, which is frequently known as the good cholesterol. It also lowers triglycerides and blood pressure. It improves blood glucose control, preventing the development of diabetes, and is probably the most important factor for maintaining body weight and lean body mass, muscle mass, and tissue as we age. So I alluded earlier to American Heart Association recommendations for exercise. So that's kind of the answer to the question posed on this slide: how much do I need to exercise? So the American Heart Association recommends that all individuals achieve a minimum of 150 minutes per week of moderate intensity activity, or 75 minutes per week of vigorous activity. And this amount is why do we have these recommendations? Well, these amounts of physical activity are clearly associated with reduced risk of heart attack, of heart disease. Is 75 minutes of moderate intensity activity beneficial? Yes, probably. Anything is better than nothing. But we have clear evidence that this amount of physical activity is associated with significant reductions in risk of heart disease. As I alluded to, there does not appear to be a minimum threshold, however, and there's evidence to suggest that just standing a few hours a day may reduce mortality, and the intervals of as little as 10 minutes have shown benefit. Along those same lines, all the activity that is encountered throughout the day and throughout the week, even in 5-minute spurts, is additive. So I encourage a lot of my patients to take 5-minute breaks every hour while they're at work. And you've achieved more than a half hour of physical activity throughout the working day if you take an active 5-minute break every hour. And this is a curve that shows that clear demonstration of a reduction in cardiovascular disease risk in association with those 150 minutes. And as this figure clearly lays out, I think, when you're over on the left here, where there's little to no physical activity, you're at very high cardiovascular disease risk. And that's a bad thing. But if you want to look on the bright side of it, you get a lot of bang for your buck. So going from nothing to anything gets a big reduction in that cardiovascular disease risk. Whereas a similar increase when you're way out here gives you additional benefit for sure, but it's the absolute reduction is much less. So does it matter what type of exercise I do? So as I mentioned, there's moderate intensity, there's vigorous intensity physical activity. So what does that really mean? So these are some examples of moderate intensity physical activity. So brisk walking of 3 miles per hour. So working in Manhattan, every patient I see, I ask them to tell me about their exercise. Many will, downplay their participation in physical activity. Say, "Oh, I don't do much exercise," and I'll look at where they live. I say, "Do you live in New York, in Manhattan?" "Yeah." "Would you walk?" "Well, of course." Well, you know what? If you're walking on the streets of Manhattan and not getting knocked over by your fellow pedestrians, every minute you're doing that is moderate intensity physical activity. That's brisk walking. Of course, other moderate intensity physical activity and exercise includes bicycling at a leisurely pace, water aerobics, doubles tennis, ballroom dancing, gardening. Again, activities that you're being active, maybe not things that someone would consider exercise, quote unquote, not the gym, which hardly has a monopoly on beneficial physical activity. Vigorous intensity physical activity, likewise, can be activities that you pursue in the gym, but that can be done elsewhere as well. So uphill walking, race walking, certainly running or jogging, whether you're doing it outside or in the treadmill, on a treadmill, bicycling more rapidly, singles tennis, aerobic dancing or high intensity dancing, be at home or at a studio or at a wedding, what have you. Heavy duty gardening and housework are considered vigorous intensity physical activities. So what about resistance training? All those things I was alluding to earlier, we consider more cardiovascular aerobic training. They're done for, a period of, of course, more than 10, 15 plus minutes. They lead to a sustained heart rate. What about resistance training? So resistance training is less clearly associated with cardiovascular benefit per se, but especially as we age, the benefits of resistance training are maybe even more profound, because either alone and in combination with aerobic training can lead to improved quality of life and ease of activities of daily living. Because as we age, we tend to lose muscle mass, and our bone and muscle strength is impaired, and it can put us at risk for falls and decreased ability to perform activities of daily living. And so participating in resistance training can help maintain bone and muscle strength, avoid falls, keeping someone independent as they age. Likewise, resistance training combined with aerobic training is likely most beneficial for improving body composition, whereas resistance training may not result in any weight loss per se. It certainly will result in an increase in muscle mass. But as you can see, the combination of aerobic training and resistance training can result in weight loss without a loss of potentially even a gain in muscle mass and the greatest losses of body fat. The key to benefiting from any exercise is actually performing it and adhering to it, making it part of your routine and lifestyle. And when I counsel patients, and not just myself, but anyone who's a trained exercise physiologist or exercise professional, they talk about the FIT principle: frequency, intensity, time, and type, and then progression. Progression meaning moving beyond what you used to do to achieve greater amounts of cardiovascular fitness and challenge. So to begin with frequency, So as I say here, ideally do it on most days of the week. Something be aerobically active most days of the week. If you're going to try to set aside, 30 plus minutes to do focused exercise, then, more practically, maybe that's going to be on, try to do it on most days of the week, 3 to 5 times per week. Less frequent resistance training for as we're mostly interested in maintaining cardiovascular health. And then, of course, progression. As you move from not being very active to becoming more active, then you're going to work on progressing into the I and T portions of the principle. So intensity, as you're progressing, maybe you're going from moderate to vigorous levels of physical activity. And a lot of patients will ask me about my heart rate's this, my heart rate doesn't go high enough. I encourage people to not become so obsessed with that, because this is not magic sauce. This is just being active and benefiting your heart. And if you really, I think the easiest way and the most stress-free way to determine, are you working hard enough? Are you actually working when you're exercising? Is looking at a rating of perceived exertion, RPE. And this is an example of a chart that suggests that. So I often will tell people to do the sentence test. So a level, if you're looking at a scale of 1 to 10, 4 to 6 would be moderate activity. As you can see here, you're breathing heavily, but you can still hold a short conversation. Like I said, walking on the streets of New York is a moderate intensity physical activity. 7 to 8 is going to be a vigorous activity. You're short of breath. You can still speak a sentence, but if someone on the treadmill next to you is trying to have a conversation, you're probably getting a little irritated. And this is vigorous activity is exercise that's going to cause you to break a sweat if you're doing it for more than 10 minutes. And then time, as I alluded to, 150 minutes per week of moderate intensity activity, 75 minutes per week of vigorous. If you're really busy and you want to carve out 20 to 30 minutes per day, great. But again, 5 minutes here, 5 minutes there every hour, a little bit in the morning, a little bit in the evening, a little bit in the afternoon. There's no difference as far as the cardiovascular benefits, as far as the research would suggest. And then time, as I alluded to, aerobic, cardiovascular, those things that keep your heart rate up, in addition to muscle toning, resistance training, and then flexibility, stretching. Again, another type of physical activity that can be very beneficial for maintaining muscle and bone health, flexibility, stability, and ability to participate in activities of daily living as we age. And then also being functional and goal specific. I talk to patients sometimes who say, I hate the gym, but it's cold outside. It's the only time I'm going to exercise, but I just hate to go there. But then I talk to them about kind of why they want to exercise. Like, well, I have a hard time walking up stairs. Like, well, in that case, when you're at the gym, work on the Stairmaster, because, there are different machines at the gym. There are bikes, there are Stairmasters, there are treadmills, there are rowing machines, and they work different muscles, and they're all going to benefit the heart. But if you can benefit your heart while also training your leg muscles on the Stairmaster so that it's easier for you to climb the stairs of your building, well, then, extra benefit is occurring right there. Might as well do double duty, two birds with one stone, while you're pursuing your exercise and cardiovascular goals. So often patients will ask me what activity is right for them, and I am not the person to answer that. The only person who can answer that is themselves. But I tell people is that the best activity is one that's enjoyable for you and that you do anyway, that you wouldn't even see as exercise. Like going cycling in the park is exercise, but if maybe you hadn't thought about that because you just love doing it, getting out in the fresh air in the springtime or summer and cycling with your spouse or child, that's exercise. But, just because it doesn't happen in the gym, please. Like I said, more than 50 years ago, the gyms did not have the monopoly on exercise. And of course, this can be dancing, gardening, hiking, strolling, any type of physical activity is qualifies. It's no different than, a treadmill, by all means. Additionally, you should feel competent and safe while participating in it, for sure. Uh, Hopefully, if you find it enjoyable, then you're not feeling scared while you're doing it, and should be readily accessible. If you love surfing, okay, well, that's a wonderful type of physical activity, but again, maybe not the most accessible thing to do in New York City, unless you live in a few particular neighborhoods with ready beach access. Other ways to make sure that you're staying active is to enlist others that can help keep you accountable and try to do it in a group activity, either as part of a group class, be it formal or informal. Informal being one that you establish on your own with one or more individuals. Certainly making it a contest. So there's bragging rights involved or some ego involved there to keep you engaged and to make it more likely for you to participate if you're one that's prone to kind of losing interest in maintaining physical activity. And then again, this is something that I think I've mentioned multiple times throughout the lecture, but maximizing your bouts of short activity throughout the day for a few reasons. One, like research has shown that when we are trying to work for more than an hour at a time, productivity really falls off. And taking a break of any sort, but in particular, taking a break that involves physical activity, can help maintain focus and maintain intellectual productivity, in addition to adding to your cardiovascular health. So, during like I said, multiple times, 5 minutes every hour, I encourage, rather than taking a break to check your email or surf the internet or some apps on your phone, get up, walk up and down a few flights of stairs, go outside the building, walk around the block, heck, do a few push-ups or jumping jacks in your office, get your blood flowing. Also, get off the subway or bus a stop or two early. Yeah, it's going to add 5 or 10 minutes onto your commute, but those 5 or 10 minutes are physical activity and exercise that you wouldn't have otherwise gotten. Like I said, do something every hour on your phone, and just be active throughout the day. It all adds up. And so with that, I think people have become very familiar with the diet food pyramid. This is a dated physical activity pyramid, but nonetheless, it's still apropos down at the base there. As I've tried to emphasize throughout this talk, foundationally increase your activities of daily living. So things like walking your dog. I haven't even mentioned that, but yeah, any activity with pets, playing with your dog, doing things with pets, take to the stairs, garden, do housework, etc. Then more focused activity 3 to 5 times a week. Recreational activities and aerobic exercise. Like, again, notice everything on here, not necessarily requiring a gym. Swimming in a pool, cycling somewhere, playing a ball sports, kayaking, martial arts, any of those activities that many people enjoy, not at all because they're exercise, quote unquote. Other times through the week, do flexibility and strength training. Of course, walking a golf course could be included down in the aerobic exercise component, and then minimizing the amount of sedentary time that you have. And that's something that I haven't even really alluded to in this talk, but being sedentary, this is another reason to do the at least 5 minutes per hour of physical activity, because being sedentary and being physically active are not necessarily a yin and yang. You can be incredible. I mean, you could run a marathon every day, but if you are completely sedentary the other 21 hours of the day, your cardiovascular fitness may actually be less than someone who is active in bits and pieces, for 60 minutes a day. Just because once we become sedentary and sustain that for hours on end, there's some cardiovascular detriment to that behavior. And yeah, so those are my information. Again, I want to thank Dennis for this invitation, for the opportunity to speak with you here today, and happy to take some questions.
Okay. Thank you very much, Dr. Heffron. That was great. It was a great overview. And I put this in about exercise because it's just absolutely essential. I'm all about prevention, as you are. And I always talk about, the 4 pillars of your nutrition, exercise and flexibility, stress management, and sleep. And so we have this talk about exercise every couple of years because it's just to remind people that it's absolutely essential to do that. And it's really easy. So whatever you can manage, you do it. If it's walking, as you've pointed out, you just have to walk 150 minutes a week, and that's sufficient to lower your cardiovascular risk significantly. So we've got some questions that were sent in. I'll just ask you those, and then we'll get to the ones that were sent in during your talk. Does the lack of exercise increase or decrease high blood pressure in people under 40? Is heart disease linked to high blood pressure? And I'll just add something to that because there's also a question about what does exercise do to your blood pressure? What happens to your blood pressure during exercise, and how does exercise affect you if you've got hypertension?
Yeah, so heart disease is certainly linked to high blood pressure. High blood pressure is a critically important risk factor for developing heart disease, and cerebrovascular disease, stroke, etc. And lack of exercise, being sedentary, can contribute to high blood pressure. Being physically active can certainly help reduce blood pressure, as I mentioned during the talk. When you are being physically active, your blood pressure goes up somewhat proportionally, typically with the intensity of the exercise. However, once you are done, you have what's called kind of a compensatory hypotension, meaning your blood pressure is reduced for the rest of the day, and there are other indirect and direct mechanisms that help sustain that lower blood pressure over the long term. But when you exercise, the blood pressure goes up, but then the rest of the time it has an overall lowering impact on your blood pressure.
Yeah. So just to add to that, when you're actually exercising, your heart has to contract more forcibly, and that's one of the determinants of high blood pressure. But you also vasodilate. The blood vessels actually dilate and they get wider. So once you slow down the exercise and your heart rate drops and your contractility drops, you actually get a lowering of blood pressure. And that's something that can be sustained. So it's really important to realize that when you exercise and you do it regularly, it's actually a wonderful way to control blood pressure. And it helps people who actually have hypertension. So that's an important thing to know. How can you avoid injury if you're considerably overweight?
I mean, I guess this is probably more on the kind of the orthopedic question side, but I would, say not doing anything that puts you at risk for falling or anything like that. I guess I would say, how can you avoid any injury in physical activity, regardless of who you are, would be kind of like choosing activities that you're very familiar with, that you feel safe and comfortable with. But I suppose if you're very overweight, doing things such as, being low to the ground, a rowing machine, a recumbent bicycle, certainly kind of water type of activities would be kind of low impact and would tend to avoid orthopedic kind of problems related to overweight. I
think the other thing is swimming is very helpful in that situation. As you pointed out, water And also when you are exercising, that you're using the handlebars of the bike or the handlebars of the treadmill to exercise to prevent injury is very important. Next slide. What fat burning exercises are recommended for women over 60 years old?
So I guess the first thing I would say is that there's no really such thing as a fat burning exercise. Every exercise burns calories, and I'll be honest that I know I showed a slide earlier that looked at kind of resistance training and body fat and lean tissue. I mean, if you look at the axes on those graphs, there's not a lot of fat being lost. It's the key feature of those is the maintenance of lean tissue. When to lose weight, we need to take in fewer calories than we burn. And yes, and exercise is an important contributor to burning those calories, but the more important thing as far as weight loss would be concerned is reducing your consumption of calories. So again, exercises for anyone at any age, the recommended ones are ones that you enjoy, because then you're more likely to do them more often at higher intensity and for greater periods of time, and think less about it, enjoy them more, and derive the cardiovascular benefit from it.
What about receiving an Apple Watch alert for your heart has shown signs of an irregular rhythm, and that alert from the Apple Watch? And how accurate is this?
Yeah, as we're understanding it, the algorithms for the wearables, especially Apple Watches, for heart rhythm abnormalities are pretty sensitive. So yeah, if you're getting an Apple Watch alert these days, you have an irregular rhythm. It's not guaranteed. I've certainly had patients, send me their strips, and it's not something. It may be irregular, but it may not be anything to worry about. But it should be something that you should bring to the attention of your physician or cardiologist, because they are pretty sensitive these days. It's unlikely to be noise, as we'd say.
I actually have an Apple Watch, and it really is incredible because you can actually just using your thumb and forefinger on the watch, you can actually get a rhythm strip, and it's really come a long way. It's actually quite reliable, and it'll tell you whether or not it thinks you're in atrial fibrillation, which is an important arrhythmia that we worry about. And it's something that's very helpful as well for people who have symptoms. Sometimes they think, well, it's my heart irregular, and you can actually see right away from the Apple Watch if your heart looks regular and you're feeling some kind of symptoms. It reassures you, and it's very helpful for the doctor, because he may say to you, well, what did your Apple Watch show? There's a lot of times we're putting monitors on people to try to pick up what their rhythm is during the time that they're symptomatic, and these wearables can be very helpful. Next slide.
Along those lines, I mean, we used to put in implanted monitors for people, but
Right.
now when I have those conversations, I'll say, well, that's one thing we could do, or you could ask for an Apple Watch for your birthday and get a
Have your
toy
procedure.
that has other benefits as well, and is probably just as accurate. So
And a lot cheaper.
yeah.
Next slide. Is there a cardio exercise program that would do the trick for osteoporosis? And maybe you could just mention, osteoarthritis. We get a lot of questions about that, and I wanted to tell people that I'm going to have a program about osteoporosis and osteoarthritis. Dr. Heffron mentioned that exercise is anti-inflammatory, and that can be very helpful, specifically, for osteoarthritis and osteoporosis. But what do you say about exercise program for osteoporosis? Any change in the type of exercise that you would do?
One thing to, I suppose, consider would not to be, maybe again, always in consultation with your endocrinologist or bone health doctor, but avoiding anything that's particularly high impact or something, even though high impact on the bones can be helpful and beneficial, as is resistance training. you wouldn't want to do something that's so high impact or maybe like it requires so much side to side movements or something that would put your joints at risk given their fragile state. But I guess I would say that that's a question that I would defer to the osteoporosis expert, kind of to specifically address that.
I would just add to that in general, the recommendation I give is, we know that if you walk, that's probably better, the impact that you have just walking, than if you swim when you're talking about
Right.
bone density. So you do need some kind of impact if you've got an osteoporosis problem, but certainly you don't want to do something that would put you at risk. And so it's very, very important to discuss that with your physician. What is the recommended exercise for healthy people around 80? So elderly patients, is there any, I think you touched on this, but maybe you're just going to repeat it.
Yeah, well, yeah, kind of again, continue to do what you've enjoyed doing for
Exactly.
the previous 80 years. Again, if you've enjoyed things that may require a little bit more mobility or agility, you might need to cut back on those, but certainly walking, dancing, swimming, anything like that that makes that you enjoy, keep it up. Again, this is somewhat connected to osteoporosis. I mean, being in age 80, often many people are going to have osteoporosis, and the concerns about the risk of falling and bone fractures and things becomes prominent. So, if you like cycling and you used to like cycling fast around the park, make sure that you're still competent with that, because falling off may have bigger impacts at age 80 than at age 40. So you might want to do that in a more restricted environment of a gym or something like that. But just keep being active and doing what you enjoy for sure.
And I think there's another important point, Sean, which we know from the Harvard study, that socialization and not being lonely is so important. Is so important for people, and it's a wonderful way to keep fit and be social. So meeting with people to walk with them, dancing, maybe as you said, cycling together, but you get the benefit not only of the exercise, but actually having social interaction, which is a key aspect for longevity.
Yeah.
I'm sure you agree with that. And next question. I think those are the questions that were sent in. Let me give you some of the questions that were sent in while you were talking. We got one about how exercise affects blood pressure, and we mentioned that. Does NYU offer cardiac rehab if you've had a procedure elsewhere?
Oh, we certainly do offer cardiac rehab. We're one of the few in the city, actually. Unfortunately, I wish there were more. But yes, we see patients who you can have gotten your procedure anywhere and go to cardiac rehab at NYU.
And the person who answered this question has been a patient at NYU for a long time, and I'm sure we'd be able to work that out.
Oh yeah.
What if someone meets the exercise guidelines throughout the life, but there are some months where guidelines are not met? How does it affect your health? In other words, if you have to drop off for a few weeks, does that impact you negatively, or do you think you can catch up?
Oh, well, I say certainly not impacting your cardiovascular health long term. Just like I tell people, you know what? All the birthday cake that you ate in your life, not impacting your heart health long term. That's what life is for. You take breaks and things. Certainly taking time off, either for an injury or whatnot, will impact what we say cardiovascular fitness, meaning how in shape you are. Unfortunately, that does drop off quickly. So if you've been active consistently for months and then you have to take 3 weeks off, unfortunately, it'll take more than 3 weeks to get back into the shape you were in, because the mechanisms that create your cardiovascular fitness are different than those that protect you from high blood pressure and heart attacks and things like that. So they're two sides of the same coin. But as far as protecting yourself from heart attacks, strokes, and whatnot, a little time off via injury or vacation, what have you, nothing to worry about.
One of our participants pointed out that her cousin was diagnosed with atrial fib via the Apple Watch.
Hmm.
So just to our point we were making. So there's a question here about being able to consult with you. And we want to put that number up. Anya, if you could do that. This is how you can get an appointment with Dr. Heffron or anybody in our prevention team. There's the number, 212-263-3400. That's how you can be in touch with us. The website, nyulangone.org/CVD prevention. And as I said, you can get to the previous lectures and talks through YouTube. So that's it for today. I want to thank you very much, Dr. Heffron. That was outstanding. This is how you stay connected with us. nyulangone.org/heart health lectures. There's our email. We're on Instagram and Twitter. Keep in touch with us. Tell us if there are any topics that you'd like to hear about or anything else that you're interested in. We all about trying to make you happy and talk about prevention. I'm hoping to give a talk in May, so stay tuned. I'm thinking about doing a talk on lifestyle, medications, and devices, how they affect cardiac longevity. So we're just coming up with a date, and hopefully I'll be able to organize that. Otherwise, I want to thank the audience and our participants. I want to thank you, Dr. Heffron, for an outstanding talk. And as always, Anya, thank you so much for your help. And we look forward to seeing you next time. And keep in touch with us so we can let you know if and when it's organized in May before our summer recess. Thanks again, Dr. Heffron.
Thank you. Have a nice evening.